Ignore these critical body regions for just 5 minutes, and you're risking more than just your pride. You're inviting humiliating odors, festering infections, and a rapid, merciless decline in your self-worth. Imagine confidently entering a room, warmly greeting loved ones, only to see them discreetly recoil, eyes avoiding yours. Noses wrinkling at a subtle yet devastating stench. Millions of seniors unknowingly harbor colonies of foul-smelling bacteria, thriving deep in hidden skin folds, crevices standard showers barely touch. Envision this horror: a cherished grandparent dressed in their Sunday best for a grandchild's wedding, blissfully unaware that a silent, pungent invader is driving loved ones to maintain a polite yet heartbreaking distance. One tiny oversight, a hidden crease, a neglected fold can ruin cherished moments, transforming joy into quiet humiliation. Tragically, most realize this only after the damage is done. Now picture an elderly woman, late 70s, recently retired, blissfully sipping tea alone, when suddenly a persistent, nauseating odor fills her home. She searches desperately, garbage bins, kitchen drains, carpets, but finds nothing. Days become weeks and the smell worsens, gripping her with anxiety and dread. Friends stop visiting, family hesitates to step inside. The chilling truth: a neglected skin fold has silently bred bacteria, sweat, and rotting skin cells into a vile, musty aroma, saturating her clothes, furniture, and every corner of her once beloved home. By the time she discovers the horrifying truth, she's already isolated by shame, barely daring to leave her home. You might think this scenario is exaggerated, but as an award-winning physician journalist, I assure you, this nightmare is horrifyingly real. Tiny, overlooked areas of your body can quickly become festering breeding grounds for odors strong enough to shatter your confidence and disrupt your life. This isn't merely about embarrassment, it's about health, dignity, and the freedom to live without fear. In the coming moments, I'll expose 5 hidden danger zones on your body, quietly cultivating embarrassing odors. You'll hear chilling true stories of individuals whose neglect cost them dearly, socially, emotionally, even physically. Together, we'll dive deep into the unsettling science behind why these hidden crevices become odor epicenters. More crucially, you'll learn exactly how to cleanse and protect yourself before it's too late. Stay with me because I'll reveal something shockingly overlooked: the powerful role of diet, especially targeted detox strategies that could reduce offensive smells from the inside out. I'll also provide you with a simple, life-changing 7-day checklist to reclaim the freshness you feared was lost forever. Don't dismiss this as trivial. Unchecked bacteria aren't just offensive. They can ignite severe infections or worse, escalate chronic health conditions you never saw coming. Today is your chance, possibly your last, to prevent 5 innocent minutes of neglect from spiraling into 5 harrowing years of shame, isolation, and deteriorating health. Buckle up and listen closely. Your dignity, confidence, and well-being depend on it. Transition: a brief, true, or composite clinical story. 2 years ago, I encountered a patient, let's call her Mary, age 73, retired homemaker, who was referred to me for unusual rashes and a lingering body smell. Her friends had discreetly noticed. She was a meticulous lady, always well-dressed, always careful with personal grooming, the type of person you'd never suspect to have a body odor issue. She initially dismissed the complaints, thinking people were just being overly sensitive, or that it was normal for aging bodies to develop certain scents. But when her grandchildren began to ask why her clothes smelled funny, she grew alarmed. During Mary's examination, we found that her rash had progressed into a low-grade infection in a hidden skin fold she hardly knew existed. The condition thrived because of trapped moisture, friction, and bacterial growth. She'd never even thought to wash that small region so thoroughly, assuming a quick pass with soapy water did the job. Yet what we discovered was an accumulation of dead skin cells, dried sweat, and natural oils enough to foster a thriving microbe community. It was humiliating for her, but also a wake-up call. If she'd let this infection go unchecked much longer, it could have threatened her overall mobility and even her immune health. Her story is not unique. In fact, I see a version of Mary's situation play out every few weeks. Many older adults fail to realize that standard shower routines can skip crucial spots. Some complain of old people smell, a phrase that can be deeply hurtful and cause them to withdraw from social settings. They blame age, but the truth is more complex. These odor problems often stem from hidden, neglected body areas. Knowing where to look and how to clean can change everything. If you're ready to avoid Mary's distress, keep reading, because we're about to explore the science and solutions behind the 5 biggest odor traps. Pro. I know into science why these areas breed odor and what you must know. The science of bacterial growth. Let's peel back the curtain on what causes these pesky smells in the first place. When you think of body odor, you might imagine sweat as the main culprit. Yet perspiration itself is almost odorless. The real issue arises when natural oils and sweat mingle with bacteria on the skin surface. These bacteria feed on sweat components and release foul-smelling byproducts. Particularly in the older population, the skin's pH and oil production can shift, making it easier for certain microbial communities to flourish. According to the World Health Organization WHO 2020 report on global hygiene awareness, inadequate cleansing of skin folds in older adults increases localized bacterial density by up to 200%, raising the likelihood of chronic odor issues and infections. That statistic points to a stark reality. You might be washing most of your body, but leaving key pockets neglected, essentially handing bacteria a free pass to thrive. B-roll of skin folds and creases. Aging comes with its share of wrinkles, folds, and sagging skin. These structural changes aren't just a cosmetic concern, they directly impact hygiene. Each fold becomes a small cave, trapping dead cells and moisture. Without proper cleaning and drying, these areas essentially become breeding zones that rarely see enough fresh air or direct water flow. If you've noticed how a quick shower rinse hardly penetrates certain creases, then you know exactly what I'm talking about. Studies from the Harvard T.H. Chan School of Public Health, published 2018 in the American Journal of Public Health, explain that older adults often experience changes in collagen and elastin that exacerbate skin folding, providing an ideal environment for microbial proliferation, particularly in warm, moist areas. This means even if your entire body feels clean, pockets of bacteria can lurk deep within hidden spots. See connection to underlying health conditions. A neglected fold can go beyond smell. If you have chronic conditions like diabetes, vascular disease, or immune challenges, then any bacterial or fungal infection might escalate. Skin breakdown can trigger ulcers, leading to more extensive complications like cellulitis. That's why it's crucial not only for your social confidence, but also your medical well-being to keep these zones squeaky clean. Dr. Michael Greger, physician and author, states in a 2019 lecture featured in the Nutrition Facts, Org Library, minimizing bacterial hotspots by attentive washing reduces systemic inflammatory markers, especially among individuals with metabolic syndrome. If you're brushing off these hidden areas, remember that your body is an interconnected system. A minor infection in a skin crease could have ripple effects far beyond a little odor. Always consult your physician if you suspect an infection or have concerns about how your overall health might be impacted. The 5 sneaky hidden spots you must clean thoroughly. We'll dissect the 5 major trouble zones that most older adults overlook if you want to stop senior odor. Now 5 hidden spots in detox. Diet tips from creeping into your daily life. Read carefully. And remember, I'll be detailing not just why they get smelly, but also how you can address them in a way that keeps you safe and comfortable. 1. Groin crease and inner thigh fold. Why it matters: the upper thigh area, where the leg meets the torso, is a magnet for sweat, dead skin, and heat. It's often covered by tight underwear or pants, limiting airflow. Many seniors with decreased mobility struggle to twist or bend enough to properly wash this region. Plus, friction from walking or sitting can irritate the skin, creating micro tears that let bacteria creep deeper. Case study. Harold, 75, retired accountant, prided himself on cleanliness. His wardrobe was immaculate, and he always spritzed on a bit of cologne before leaving the house. Despite this care, a sour smell would build up by late afternoon. Confused, he tried everything from changing laundry detergents to applying more deodorant. A routine checkup uncovered that he'd never been scrubbing the exact fold where his inner thigh meets his pelvis. The stale sweat and natural oils were creating the smell that cologne couldn't mask. After adopting a gentle but thorough cleaning approach in that fold, Harold's odor issue disappeared within a week. The science. This zone is loaded with sebaceous glands which secrete oils bacteria love to feast on. When overlooked, the combination of sweat and skin oils becomes a feast for microbes. These microorganisms multiply faster in warm, moist environments, leading to the dreaded musty scent. Over time, you might even get rashes or fungal infections if left unchecked. Action steps 1, daily gentle wash. Use mild soap and warm water, applying with a soft washcloth or your hands. Don't scrub hard as the skin here can be sensitive. 2, thorough drying. Always pat the area dry, ensuring no moisture stays locked in the folds. Consider using fragrance-free talc alternatives if you perspire heavily. 3, check for irritation. If you notice redness or discomfort, consult your physician before applying medicated creams. 4, fabric choices. Opt for breathable cotton underwear to reduce trapped sweat. Synthetic fabrics can hold moisture against your skin. 2, belly button and lower abdominal fold. Why it matters: a deep or inward belly button is practically a cave for lint sweat and dead skin. You'd be shocked how many older adults develop crusty buildup or a sour smell that seems to emanate from nowhere, only to find out their navel hasn't been cleaned properly in weeks, if not months. And if your abdomen sags even a little, the fold beneath can trap extra moisture, becoming a perfect environment for yeast or fungus. Case study: Linda, 71, retired teacher, noticed a faint, unpleasant scent following her around. She washed daily, changed clothes frequently, and even tried scented lotions to combat it. Her doctor eventually discovered a mild fungal rash beneath her navel fold. Linda admitted she often skipped soaping and drying that specific spot, assuming the shower water alone was enough. Within days of targeting that area with gentle cleansing and careful drying, the fungal rash resolved and the odor vanished. The science. Because the navel is a narrow enclosed space, air circulation is minimal. Bacteria thrive in low oxygen, high moisture environments. Fungi and yeast can take hold in the adjacent lower abdominal fold if there's consistent warmth and dampness. These organisms release volatile compounds responsible for sharp, sour, or musty odors. Action steps 1, detailed cleaning. Every time you shower, use your finger or a soft cotton swab with gentle soap to clean inside the belly button. Rinse thoroughly. 2, dry it completely. After you step out, ensure your navel is moisture-free. A towel, corner, or cotton pad can help. 3, monitor for redness. Fungal infections often appear pinkish or slightly scaly. If you notice such changes, consult your physician for antifungal recommendations. 4, clothing fit. Avoid overly tight waistbands that trap sweat beneath the fold. Light, well-fitting clothing promotes better air circulation. 3, behind the ears and in-ear folds. Why it matters most: people focus on face and scalp hygiene, forgetting the small region just behind the ears. Sebum production can be high in this zone, especially if you wear glasses or hearing aids. The constant friction and reduced ventilation provide a nesting ground for bacteria and waxy buildup. Over time, an unmistakable musty smell can develop, sometimes detectable when someone leans in for a hug. Case study: Walter, 76, retired principal, couldn't understand why his granddaughter asked about a strange smell whenever she hugged him. He was meticulous about shaving, shampooing, and wearing clean clothes. A visit to his barber revealed flakes and greasy residue behind his ears. A few weeks of focused cleansing eradicated the odor, leaving Walter relieved and grateful for the honest observation from his family. The science. The outer ear's folds can trap sweat, dead skin, and oils. According to a 2019 dermatological study published in the Journal of Geriatric Skin Health, seniors produce slightly different ratios of lipids in their sebum, making certain areas more prone to buildup. Hearing aids can increase warmth and humidity behind the ear, amplifying bacterial growth. Action steps 1, daily gentle scrub. Use a soft cloth or fingertips with a mild cleanser. Carefully wash behind your ears and along the crease where the ear meets the head. 2, dry thoroughly. Pat dry to avoid leaving moisture. 3, device hygiene. Clean hearing aids or eyeglasses daily, removing any grime. 4, watch for flakes. If you see flaky skin or redness, it could be an early sign of dermatitis or infection. Consult your physician if symptoms persist. 4, toenails and beneath the nails. Why it matters. Feet often get quick attention, but toenails, especially the underside, are often neglected. For older adults who find bending difficult, the region under the nail can become a stash for sock, lint, dead skin, sweat, and bacteria. In thickened or fungal nails, the accumulation can be even more pronounced, releasing a potent odor that stubbornly persists. Case study. Gerald, 81, retired postal worker, complained that his daughter grimaced whenever she helped him with his shoes. He couldn't figure out why he bathed daily and wore fresh socks. But a podiatrist discovered severe buildup under his toenails, including debris that had turned discolored and malodorous. After a regimen of careful cleaning with a nail brush, antifungal solutions, and better foot drying practices, Gerald regained odor-free feet. The science-thick nails common in older age create hidden pockets for bacteria. Fungal infections, onychomycosis, thrive when nails grow slower and the immune system is less robust. These infections can take root without causing pain initially, so odor might be the first red flag that something is amiss. Action steps 1. Weekly deep clean. Use a soft nail brush or toothbrush to gently remove debris under the nails. 2. Inspect for discoloration. Yellowish or brownish tints could indicate fungal growth. Discuss with your healthcare provider. 3. Proper drying towel off between the toes and under the nails after showers. 4. Footwear strategy. Alternate shoes to let them dry fully. Wash socks in hot water if possible to kill lingering bacteria. Surround. Revive the knee crease. Behind the knee, why it matters. The area behind the knees is another stealthy culprit. Warm folded skin can capture sweat lotion, residue, and even soap remnants. Sitting for long periods, especially with legs bent, amplifies moisture and reduces airflow. Over time, this small patch can emit a stale, musty aroma that follows you around, sometimes bamboozling you into thinking your clothes or furniture are the source. Case study. Judy, 76, retired librarian, tried everything from changing laundry detergents to adding extra dryer sheets, worried about a persistent musty smell in her skirts and pants. A nurse practitioner at her primary care clinic finally spotted that the skin behind Judy's knees was slightly pinkish and always damp. By incorporating regular cleansing, thorough drying, and occasional powdering, Judy's problem disappeared within a few days. The science. Bending the knee means the skin folds over itself, promoting sweat accumulation. According to the same Harvard T.H. Chan School of Public Health study mentioned earlier, neglected folds can trap up to 30% more bacteria-laden moisture compared to open skin surfaces. This fosters bacterial growth, and if there's any friction or microabrasion, it can escalate into a rash or infection. Action steps 1. Focused shower routine. Make a conscious effort to wash this region thoroughly. A long-handled sponge can help if mobility is limited. Sort 2. Post-shower, drying gently, pat the back of the knee. Even a drop of leftover moisture can trigger odor formation over time. 3. Hydrate wisely. If using lotion for dryness, apply sparingly and make sure it absorbs fully so no residue lingers in the creases. 4. Monitor skin health. Look for signs of irritation. If you spot redness that lasts, consult your physician. Not a cerebrin. The missing spark, a 7-day checklist to reclaim freshness. You might be thinking, I shower daily, why do I need a special routine? The issue is that standard showers rarely involve mindful scrubbing of these hidden zones. You might rinse them in passing, but water alone doesn't always dislodge stubborn skin debris and bacteria. Below is a dedicated 7-day checklist to help you target these areas methodically. If you're serious about eliminating the dreaded senior odor, commit to this challenge. Start tomorrow or even today, if you can, and see how drastically your confidence and comfort improve. Day 1. Before stepping into the shower, jot down the 5 hidden areas on a small sticky note. Groin, crease, belly button, behind the ears, under the toenails, behind the knees. 2. As you wash, mentally tick each area off your list. Use a gentle circular motion to avoid skin damage. 3. Dry each area thoroughly with a clean towel. Don't rush this step. Day 2. 1. Check for signs of irritation, redness, tenderness, flakes. If you see something concerning, consult your physician. 4. 2. Continue the same washing routine, but add an extra 30 seconds behind the knees and around the groin. 3. Air out any frequently worn shoes. Let them dry in a well-ventilated area to avoid trapped foot odor. Day 3. 1. Incorporate a mild exfoliant for areas like the belly button or behind the ears if you notice buildup. 2. Use a nail brush gently on toenails. Even a few seconds per nail can remove old sock lint or debris. 3. Consider wearing looser clothing around the waist and groin to promote airflow. Day 4-1. Focus on technique. For the groin crease, hold a soft washcloth and gently lift any folds. Wash thoroughly but softly. Ensure to pat each hidden spot dry before stepping out of the shower. If you can remain in the bathroom for a minute afterward, letting any residual moisture evaporate. 3. Evaluate your footwear again. If you've been wearing the same pair of slippers for months without washing, toss them in the laundry if machine washable or disinfect them. Day 5. 1. Check your belly button more carefully. Use a cotton swab with warm water or mild soap if you find waxy residue. 2. Apply talc-free powder under the abdominal fold or behind the knees if you notice persistent sweat. 3. Make sure your hearing aids or glasses are cleaned thoroughly. Bacteria on these devices easily transfers to your skin. Day 6. Give yourself a once-over in the mirror to see if there's any lingering redness or irritation. 2. If you're prone to foot issues, consider soaking your feet in lukewarm water with a small dash of antiseptic solution once a week. 3. Use unscented lotions or creams if dryness is an issue, ensuring they fully absorb. Day 7-1. Reflect on your progress. Has the odor improved? Do you feel fresher? Are your clothes no longer picking up that musty scent? 2. Continue these steps as a regular part of your hygiene. The entire process should take only a few extra minutes each day. 3. Share this routine with a friend or relative who might benefit. Encouragement and accountability can help solidify these new habits. Pursue. Incorporating a simple detox diet approach. We've covered external cleaning, but did you know dietary changes can also reduce the intensity of body odor? When you see references to a detox diet, it often conjures images of extreme juice fasts or questionable supplements. However, there is a more balanced interpretation of detoxifying your system, one supported by legitimate nutritional guidelines that may help minimize overall body scent. The nutritional angle. Hydration: drinking enough water, aiming for around 8 glasses a day, though individual needs vary, supports kidney function and helps flush out toxins. Fiber-rich foods. Whole grains, legumes, and vegetables aid digestion and can prevent the buildup of waste products that might lead to more potent sweat. Herbs and spices. Parsley, basil, and mint have chlorophyll, which some believe can help neutralize certain odors. Avoid excess red meat. Large quantities of red meat may increase perspiration odor. Moderation is key. Remember, it's not about adopting radical diets or ignoring your physician's instructions. Always consult your physician if you have special dietary needs or chronic conditions. A moderate, balanced approach to eating, emphasizing fresh produce, lean proteins, and healthy grains can often yield tangible differences in how your body smells and feels. Additional virality enhancers. 24-hour challenge, plus anonymized case studies. 24-hour odor busting challenge. Want to see a near-instant improvement? Try this quick one-day regimen. 1 morning wash all 5 hidden spots thoroughly using a new washcloth for each area, if possible, or rinse between uses. 2 midday refresh. Use unscented wipes or a damp cloth to gently clean behind the ears, the groin crease, and behind the knees. Dry these zones. 3 evening. Soak your feet for 10 minutes in warm water. Gently clean under your toenails, then shower. Focusing on the belly button and any abdominal folds, pat everything dry. Shut 4. Next morning check. Sniff your clothes from the day before. Most people who follow this challenge notice a dramatic reduction in odor. Use that momentum to keep the practice going. Additional case studies. Case study. Clara, 65, office manager. She dealt with an unexplained musty scent in her cubicle. Co-workers began making excuses to avoid close contact. After reading an article on hidden odor spots, she realized she'd never thoroughly dried the skin behind her knees. A simple tweak using a small towel for that specific area resolved the issue within 3 days, restoring her comfort and workplace confidence. Case study. Timothy, 67, truck driver. Tim spent long hours on the road relying on quick truck stop showers, where he barely had time to wash the obvious areas. Over time, he developed a persistent groin rash that led to a strong, sour smell. Under medical advice, he began carrying a small kit with gentle soap, a soft cloth, and talc-free powder. Spending an extra minute on the hidden thigh crease not only improved the smell, but also prevented painful rashes, letting him drive more comfortably. These stories illustrate a vital point. A small effort toward mindful hygiene can pay enormous dividends, even for individuals living busy lives. Punaiso, Shirikorio, called a comment. Have you ever noticed this sign? Comment I feel it if you relate, I'm safe if not, and add a question for the doctor. Interacting with a community can encourage collective learning. Your experiences might help someone else realize they're not alone. Or perhaps you'll learn a new trick from someone who found a brilliant solution, so please share your thoughts below. Action plan maintenance follow-up and quick tips. Let's distill everything into a straightforward action plan. Think of it as your personal roadmap to a fresher, more confident life. 1 weekly checklist. Sunday deep clean toenails. Shortuna Monday inspect behind knees with a handheld mirror if necessary. Wednesday check belly button for any buildup. Use a cotton swab gently. Siri, Friday, wash behind ears with a mild exfoliant if you see flakes. 2 monthly checkup. Tar, if you can schedule a brief consult with a nurse or caretaker. Ask them to verify you're reaching all hidden spots effectively. If you notice stubborn issues, consult your physician. Never self-diagnose advanced infections. 3 dietary adjustments. Aim to include at least 1 leafy green meal per day. Maintain hydration levels if plain water bores you. Add cucumber or lemon slices for flavor. Keep a simple food journal to see if certain meals intensify your sweat odor. 4 long-term habits. Opt for loose, breathable fabrics that reduce sweating. Shroniken and rotate your shoes daily. Practice safe foot care, especially if you have diabetes or circulatory problems. Check your hearing aids or glasses daily for trapped grime. By layering these steps consistently, you can stay 1 step ahead of odor-causing bacteria and fungi. Consistency is your greatest weapon against stubborn smells. Chakotoi, Pontunaihin. Credibility and trust, 3 expert quotes. One World Health Organization who 2020, regular inspection and cleansing of skin folds significantly diminishes microbial load, which is particularly important for older populations susceptible to skin breakdown. 2 Harvard T.H. Chan School of Public Health, 2018, American Journal of Public Health. As collagen decreases with age, new skin folds create environments where bacteria proliferate, highlighting the necessity of targeted hygiene practices. 3 Dr. Michael Greger, physician and author, 2019 lecture series at nutritionfacts.org. Minimizing bacterial hotspots through attentive hygiene can lower inflammation markers, a crucial step for seniors managing metabolic disorders. Each of these sources underscores the clinical reality. Neglected body folds aren't just embarrassing. They can pose genuine health risks. Hear why you must take this seriously, potential long-term consequences. Let's step back and get an even bigger picture. Odor might be the first sign you notice, but if left unaddressed, issues like fungal or bacterial infections can escalate. These infections can breach your skin barrier, leading to wounds that don't heal easily, especially if you have diabetes or peripheral artery disease. Sometimes persistent infections cause scarring, ongoing discomfort, and repeated doctor visits. Worse, some seniors withdraw socially once they realize they have a chronic smell problem, which can trigger or worsen depression. It's not hyperbole. Losing your sense of confidence can have ripple effects on every aspect of your life, from refusing family outings to avoiding simple errands. It's also worth noting that the older we get, the more critical it is to maintain healthy skin as a defense against pathogens. According to the WHO, approximately 10% of older adults who develop skin ulcers or chronic wounds suffer complications that require hospitalization. So while the conversation might start with an unpleasant odor, the real threat is what that smell might signal lurking beneath the surface. By acting now, you not only protect your social well-being, but potentially avert larger, more dangerous medical issues. Extended fear factor. Imagine the worst-case scenario. Picture a scenario where an elderly individual, let's call him Robert, 78, neglects these hidden spots because he believes it's too much trouble. He starts noticing a strange odor but brushes it off. Slowly, a fungal infection sets in under his belly fold. It spreads, irritating the skin until tiny cracks form. Bacteria enter these cracks, leading to cellulitis, a deep infection that causes intense redness, swelling, and pain. Robert ends up in the hospital with intravenous antibiotics. While recovering, he's too ashamed to have visitors concerned about the odor and his appearance. Yes, this is a grim picture, but it's also a reality I've witnessed. All of it could have been prevented with a few extra minutes in the shower, a willingness to properly dry neglected creases, and a quick visit to his physician at the first sign of trouble. Do you want to wait until it reaches that point? Or do you want to safeguard your health and dignity starting today? Honin, busting myths about old people smell. You may have heard the term old people smell bandied about. Some assume it's an inevitable byproduct of aging like wrinkles or gray hair. While natural changes in skin and oil production can occur, as we age, the musty or sour odor often associated with older adults generally boils down to a combination of neglected hygiene in tricky areas and possible dietary or metabolic changes. There's no universal rule that says you must give off a particular aroma at a certain age. In fact, many older adults who actively care for these hidden spots maintain a neutral, pleasant scent. The biggest myth is that it's all just part of growing older. Wrong if someone tries to tell you that you can't do anything about it, they're misinformed. Proper cleaning, thorough drying, balanced nutrition. These are powerful tools that remain effective no matter your age. Don't accept the myth as your fate. Ifi, common excuses and how to overcome them. One, I'm too busy or too tired. Reality focusing on these spots adds only a few extra minutes to your routine. Over time, that small investment can save you from humiliating scenarios and potential infections. Two, I have limited mobility. Reality tools like long-handled sponges, handheld mirrors, and assistance from caregivers can bridge the gap. If you're willing to adapt, you can safely reach hidden areas without straining. Three, I already shower every day, why bother? Subconera reality. Simply running water over your body doesn't always dislodge stubborn debris and folds. You need targeted attention, especially for the 5 sneaky areas we've discussed. 4, my skin is too sensitive. Shurniprithia reality. That's precisely why you should focus on gentle yet thorough cleaning. Avoid harsh scrubs or very hot water. Consult your physician for product recommendations suited to sensitive skin. Favorud is shuruin. I'm embarrassed to ask for help. Cheat reality. There's no shame in seeking assistance, especially if it prevents bigger health issues. Hiring a homemade or enlisting a family member for tough spots is a practical solution. A serenistrum. Show support systems involving family and caregivers. If you live with family or have regular caregivers, consider openly discussing the importance of cleaning these hidden areas. Explain that while it may seem awkward, it's critical for your health. Most caregivers appreciate direct communication. If you rely on professional home health aides, request that they spend extra time ensuring all folds and creases are washed and dried. Provide them with a checklist if necessary. If you have a spouse or partner, let them know how they can help spot any trouble areas you might miss. Teamwork can reduce the embarrassment factor and ensures you both stay proactive about hygiene. Kuri, the emotional side of body odor in seniors. Let's talk about the emotional toll. Discovering you have an unpleasant odor can trigger shame, withdrawal, and sometimes anxiety about leaving the house. Many older adults fear they'll be gossiped about or, worse, avoided altogether. This emotional spiral can drastically reduce social contact, intensify feelings of loneliness, and even lead to depressive symptoms. You might become hypervigilant about smells sniffing your clothes or apologizing whenever you enter a room. Some individuals even shy away from medical appointments, ironically postponing help that could resolve the underlying issue. Remember, knowledge is liberating. By applying the insights from this script, you can regain peace of mind. If you're reading this on behalf of a loved one, consider how powerful a supportive approach can be. Offer help in a kind, non-judgmental way. Remind them that everyone has blind spots in their hygiene routine and that solutions are both accessible and effective. Kibana call to comment reminder. Let's not forget to spark engagement one more time. Have you ever noticed this sign, comment, I feel it? If you relate, I'm safe if not, and add a question for the doctor. Your input can guide others toward better self-care, and you'll be part of a larger conversation that breaks down the stigma around senior odor. Hey, 90. Fact rapid fire questions 1Q. Does cleaning more often dry out or damage older skin? A over-cleansing can irritate if you use harsh soaps or very hot water. But focusing on hidden folds with a mild cleanser is typically safe. Always moisturize appropriately afterward and consult your physician if you have specific skin conditions. 2Q, can I use scented powders or sprays to mask the odor? A scented products might temporarily mask odors, but can also irritate sensitive skin or trap more moisture. Opt for fragrance-free, talc-free powders or dermatologist-approved creams. 3Q is a detox diet necessary for odor control. Extreme diets are not recommended without medical supervision. However, a balanced approach, drinking plenty of water, eating fiber-rich foods, and including fresh herbs can help diminish odor from within. 4Q. What if I can't reach my feet or behind my knees safely? Adaptive equipment, long-handled scrub stools for the shower, and professional caregiver assistance can make a world of difference. Safety first, never risk a fall. AWU, Sir 101. Professional disclaimer. Nothing in this script is meant to replace personalized medical advice. Always consult your physician before making significant changes to your hygiene routine or diet, especially if you have chronic conditions. Continue following any prescribed medications or treatments. This discussion aims to highlight common hygiene gaps and empower you with effective strategies. Conclusion, recap, engagement, and one final question. You've made it to the end of this extended deep dive into eliminating hidden body odor traps. Let's sum it up with 3 rapid-fire bullet points. 1. Identify neglected spots. The 5 main areas: groin, crease, belly button. Behind the ears, toenails, and behind the knees are prime locations for bacterial and fungal growth. 2. Adopt a thorough routine. Use mild soap, gentle scrubbing, and meticulous drying. The key is consistency and paying attention to often overlooked folds. 3. Support from within, balanced eating. Think fresh produce, whole grains. Hydration alongside these targeted hygiene practices can further reduce odor intensity. Now, if you found this script useful, please hit that like button, subscribe, and share it with friends or family who might need this information. Let's spread the word, because no one should have to endure the embarrassment or health risks of neglected hygiene. And don't forget to drop your comments below. Your story or question could help someone else. Here's one final question to keep the discussion lively. What is one small change you can make today to improve your hygiene in these hidden areas? And how do you plan to follow through on it? Share your thoughts, and let's keep this conversation active and supportive. Stay vigilant, stay fresh, and remember, your health and confidence are worth every extra moment of care.